Every 40 seconds, somewhere in the world, someone has a stroke. And in a surprisingly large number of cases, the brain tried to warn them first. A hand that suddenly became weak for 2 minutes. A sentence that came out wrong, then returned to normal. A brief moment where balance disappeared for no obvious reason. Most people dismiss these episodes because they pass quickly, but neurologists see them very differently. Because a major stroke rarely begins at the exact moment someone collapses. In many cases, the process started years earlier, inside blood vessels that were slowly becoming inflamed, narrowed, unstable, and metabolically damaged. What most people call a sudden stroke is often the final stage of a long biological process the body has been signaling for a very long time. Today, we're going to break down the real science behind those warning signs. What is actually happening inside the brain before a stroke occurs, why transient symptoms can be more dangerous than persistent ones, and how recognizing them early may protect far more than survival itself. It may protect the part of you that makes you, you. Stroke is rarely sudden. Most people think a stroke happens out of nowhere. You are talking normally, walking normally, living normally, and then suddenly the body collapses. But biologically, that is usually not how stroke develops. In reality, most strokes are the final stage of a disease process that has been silently evolving inside the blood vessels for many years. Long before the first symptom appears, the arteries feeding the brain are often already changing. The inner lining of the blood vessels, called the endothelium, slowly becomes damaged. This damage can come from high blood sugar, high blood pressure, smoking, chronic inflammation, poor sleep insulin resistance, or years of metabolic stress. And once that protective lining becomes injured, the blood vessels stop behaving like smooth, flexible pipes. Inflammatory cells begin sticking to the artery walls. Cholesterol particles enter damaged areas. Tiny plaques gradually form. Over time, those plaques become unstable. Some narrow blood flow slowly. Others suddenly rupture and trigger clot formation. And this is where many strokes truly begin. Not in one dramatic moment, but in years of silent vascular deterioration. The frightening part is this. The brain often tries to warn us before a major stroke happens. Doctors call these warning episodes transient ischemic attacks, or TIA. Many people casually call them mini strokes. But neurologists dislike that phrase because there is nothing mini about what they represent. A TIA means part of the brain temporarily lost blood flow, usually because a small clot briefly blocked circulation, then dissolved, or moved away before permanent brain tissue death occurred. That is why symptoms may only last 2 minutes, 10 minutes, sometimes 1 hour, then suddenly disappear. And that disappearance is exactly what makes TIAs so dangerous. Because people feel relieved, they tell themselves, "I'm okay now." But medically, the brain has just demonstrated that blood supply is unstable. And research shows something extremely important. The risk of a major stroke rises dramatically within the first 24 to 72 hours after a TIA. That short period may be the final opportunity to prevent permanent disability, because the next clot may not move away, the next blockage may completely shut down blood flow. And unlike muscles, brain cells die extremely fast when oxygen disappears. Within minutes, neurons begin failing. And unlike skin or liver tissue, many brain cells do not regenerate once destroyed. That is why stroke is not simply about survival. It is about function. A person may survive, but lose speech, memory, movement, swallowing ability, emotional regulation, or independence. And for many older adults, that loss of independence is more frightening than death itself. Warning sign number 1, temporary vision loss. One of the most overlooked stroke warnings involves the eyes, especially sudden vision loss in only one eye. This symptom often appears quietly. You may be reading, watching television, cooking, walking into another room, and suddenly, vision in one eye becomes dark, blurry, gray, foggy, or partially blocked. Some people describe it as like a curtain slowly falling across the eye. Then a few minutes later, vision returns completely to normal. Most people assume fatigue, eye strain, blood pressure, changes aging eyesight. But neurologists become very concerned when this happens, because the retina is one of the most oxygen-sensitive tissues in the entire body, and the artery supplying blood to the eye comes directly from the carotid artery, one of the main vessels feeding the brain. In many cases, a tiny clot temporarily blocks retinal blood flow. This condition even has a medical name, amaurosis fugax, temporary monocular blindness. But what matters most is understanding what the symptom means biologically. It means circulation to part of the nervous system was interrupted, even briefly. And if a clot can temporarily block blood flow to the eye, it can also travel upward into the brain itself. That is why neurologists often treat temporary blindness as a vascular emergency, because the eye is sometimes the first visible warning that the brain's circulation is becoming unstable. Warning sign number 2, numbness, weakness, or a drunk walk. Another extremely common TIA symptom is sudden numbness or weakness affecting one side of the body, especially one arm, one side of the face, one leg, or an entire side. The sensation may feel strange rather than painful. People describe tingling heaviness, weakness, loss of coordination, rubber legs, or difficulty controlling movement normally. The most important clue is how suddenly it appears. A TIA symptom often happens without warning, without injury, and without an obvious explanation. Then it disappears. This is very different from slowly developing arthritis or muscle fatigue. Stroke-related symptoms are usually abrupt because blood flow changes abruptly. Remember something important about brain anatomy. The left side of the brain controls the right side of the body, and the right side controls the left. So when symptoms affect only one side, neurologists immediately suspect a neurological cause. Some people experience something even more subtle. They suddenly walk strangely, almost like being drunk. Balance disappears. The floor feels unstable. They drift sideways, need to grab furniture, or feel severe dizziness for a few minutes. This often involves reduced circulation to the cerebellum or brainstem, areas responsible for balance, coordination, and spatial control. And unfortunately, older adults often normalize these episodes. I'm just getting old. I stood up too quickly. I must be tired. But the body does not suddenly lose neurological coordination for no reason, especially after age 50. Warning sign number 3, speech or language changes. One of the most important warning signs involves language, because speech is one of the most metabolically demanding functions of the human brain. It requires multiple brain regions working together simultaneously. Language processing, muscle coordination, memory retrieval, auditory interpretation, timing, and motor control. When blood flow temporarily drops in these regions, speech may suddenly malfunction. A person may slur words, misuse words, stop understanding language, or become unable to form coherent sentences. Sometimes they know exactly what they want to say, but the words will not come out correctly. This phenomenon is deeply frightening because the person often remains conscious while realizing something is wrong. Then minutes later, speech returns to normal. And again, this temporary recovery tricks people into ignoring it, but healthy brain tissue does not randomly lose language function without cause. Transient speech dysfunction is one of the strongest vascular warning signs in neurology, especially when symptoms appear, suddenly affect one side, or occur alongside weakness or vision changes. Warning sign number 4, the wrong headache. Not all headaches are dangerous, but certain headaches are neurologically different, especially headaches that are sudden, explosive, severe, or completely unlike previous headaches. Some people describe intense pressure, electrical pain, the worst headache of my life, or pain combined with confusion or vomiting. This matters because blood vessels inside the brain may already be under dangerous stress. In some cases, a weakened vessel may be leaking or preparing to rupture, especially in hemorrhagic stroke. the type caused by bleeding inside the brain. This is why doctors pay attention not just to pain intensity, but to headache pattern. A dangerous headache often feels biologically unfamiliar, different from normal migraines or tension headaches. And unfortunately, many people simply take painkillers and go to sleep. But medication may temporarily hide symptoms, while the vascular damage continues worsening underneath. Warning sign number 5, face or arm drift. Neurologists use very simple physical tests because the brain controls symmetry extremely precisely. Try smiling. Does one side of the face move less? Does one corner droop slightly? Try raising both arms. Does one arm slowly drift downward? This happens because reduced blood flow weakens motor signaling from the brain. Sometimes the weakness is subtle, especially early on, but asymmetry matters enormously in neurology. The brain is designed for coordinated bilateral control. When one side suddenly stops responding normally, doctors immediately become concerned about interrupted cerebral circulation. And once again, even temporary symptoms matter, because temporary dysfunction means unstable blood flow already exists somewhere inside the vascular system. What to do immediately? If these symptoms appear, time becomes critical, because modern stroke treatment works best within a limited window, especially treatments that dissolve clots or restore circulation. The first thing doctors want people to do is note the exact time symptoms began. That information directly affects treatment decisions. Second, never drive yourself. A worsening stroke can rapidly impair consciousness, coordination, judgment, or vision. Third, call emergency services or family immediately. And fourth, do not self-medicate randomly. This is extremely important because not all strokes are caused by clots. Some are caused by bleeding, and taking the wrong medication, especially blood thinners, can sometimes worsen hemorrhagic strokes dramatically. That is why proper imaging, especially CT scans, is essential before treatment decisions are made. Aging is not only about adding years to life. It is about preserving the systems that allow you to remain yourself. Your voice, your memories, your ability to walk independently, your ability to recognize the people you love. And sometimes, the body gives one final warning before those systems are permanently damaged. The question is whether we recognize it early enough. If this video helped you understand stroke warning signs more clearly, subscribe to the Aging Code and turn on notifications. Every week, we explore the biology of aging, brain health, metabolism, and longevity through science that is deep enough to matter, but simple enough to actually use in real life.